We are here to do exploratory lab for Jane Doe. She got ANSEP at 7 p.m., 1 gram, no known allergies. Everybody agree? Agree. I'm going to talk to you today about how to be a surgical tech for a surgical procedure. So there are 3 key points in becoming doing a surgical procedure. The first point is to prepare for the surgery, what you're going to need for the surgery, what you're going to get ready. The second key point is what all you are going to set up the day of surgery, how you will scrub in, and the third key point is, of course, doing the surgery, right? So the first thing I want to talk to you about is getting prepared for your surgery. Now, I mentioned exploratory laparotomy. That's usually a call case type of procedure that we do. But sometimes we do it during the day. So to get prepared for that, we have cards that we pull up, and it tells us on there what all our equipment is, what all of our what we call open stuff, that's disposable things that we get rid of at the end of a case. So it'll tell us what to open, what to have available in the room in case something else happens while we're in there. So we have to get all that prepared for our case. It tells us what equipment we will need. So if we're doing exploratory laparotomy, we usually use what we call Bovie. It's our electrocautery is also the word for it. So it'll help coagulate and cut things, burn stuff. We also have a harmonic scalpel, which that too burns things. A little bit different sound, a little bigger vessel coverage. And then we have Bookwalter, which if we're open for an exploratory laparotomy, it's a nice big metal ring that goes around and it holds the stomach open. I apologize if I get graphic, okay? And it'll hold the stomach open so we can see down in there and see what's going on. Some people, we have to see really low in the pelvis. Some we have to see really far to the sides. That Bookwalter helps us. So that card helps us prepare for stuff like that. We also get faxes the day before or up to a week before to let us know if there's anything special that we need for the case, any certain meshes, any certain implants, stuff like that. So that's getting prepared for the case. The second point is to set up that day for the case. So when you come in, first thing you do is change out of your street clothes into scrubs. And you have shoes that you leave in the OR, or if you wear shoes in, you put shoe covers on, okay, because we don't want to bring stuff in from outside. We have laundered scrubs at the hospital that you put on, top and bottom. And then you have a scrub hat. You can launder those yourself, or you can wear the pretty little blue ones that sometimes they will give patients when they come in. They'll give them white or blue, depending on what they have there at the time. And we wear those to cover our hair because we don't want hair getting into your wound. That's no-no. So then we get our case that we pulled the day before, and we bring it into the room. We set everything up on our tables and how the room needs to be set up so no doctors get angry and kick stuff because it happens. And so we want it to all be nice so everybody's calm and does their job and we're focused on the patient. So after we kind of open, what we call open our room, then I, the surgical tech, I go to the scrub sink and I scrub my hands. That is a 3 to 5 minute scrub with Hibiclin soap and a scrub brush that sometimes likes to leave scratches. Obviously, I'm fair complected and sensitive skin, and so everybody has different skin. There's different stuff to use. You scrub in. You will at this time have a mask on. So when you're in the room already opening, you'll have a mask so you're not breathing over somebody's field. And you will come in, wet hands, come up to your scrub table, take a towel and dry your hands off, put your gown on, and your nurse will tie you up. And then you will set up your case. You get your tables and what we call a Mayo stand, and you set everything up according to the case. So on that card that I told you about the day before, there's notes for your nurses and for your techs. And that will explain to you what you need on your mail, on your back table, and your nurses has notes for your medicines and everything else they need to do. So after being prepared now you're ready to do the procedure. So when you get in there to do the procedure, we do the timeout like I did for you at the beginning of the speech. And when we do that timeout, that is what we call a hard stop. Everybody stops what they're doing, looks at the nurse, and pays attention to her. Everybody needs to know what is going on so we don't have wrongful surgeries. And otherwise we'll be sitting in long meetings. And then you do the surgery. So the doctor will cut, we'll use that cautery, we'll use harmonic, whatever we need. We'll have specimen that we obtain. So let's say on that exploratory laparotomy, we take someone's bowel out. So we're going to take the right colon, okay? So it's like from here to here, okay? We're going to take that out. Now the doctor can choose to put the colon back together with the small bowel, okay? Or he can choose to make what we call an ostomy. So then we're going to make a small incision here and pull the small bowel up. Then they will have a bag for a while, which later we will come back and reconnect. Exciting stuff, right? Am I making anyone sick yet? So then after all that is done, we will do our count, which we did at the beginning, and we will do it again at the end because we do not want to leave any instruments or laps in the patient. That's a big no-no too. That's another long meeting. And then we'll close up, dress them up, make them look nice, and they're ready to go home. So I hope I clarified everything, the 3 key points of surgery, of how we prepare for the surgery, how we set the surgery up the day of, and then how we kind of do the surgery. So thank you.